Hi everyone, this is Dr. Stefan. In this video, I'd like to talk a little bit about how to deal with breathlessness when you have advanced lung disease. So this is a topic that's really important. It comes about because I had a long conversation with one of my patients in the respiratory clinic yesterday, and he was very, very keen to actually do whatever he could do to feel better because he was really breathless. He was struggling around his house to do his normal activities, and he used to be really good at doing everything only a few years ago. So it's a big change in someone's life to have advanced lung disease. And I'd like to share some of the points from that conversation because it might be helpful. Now, obviously, this is not medical advice in your case. Your case may be completely different. So do check with your own healthcare providers. I don't anticipate that this will all apply in your case, but just some points to consider. So first of all, what is the cause? It's really important to understand whether the breathlessness is only linked to the lungs, because there may be other overlapping causes as well. And then we'll talk in the second part about what to do. So first of all, the cause. Sometimes people who have COPD, emphysema, lung fibrosis, advanced forms of lung conditions, they may think that it's all the lungs. It's all related to the lungs. Their breathlessness, that sensation that you can't get air, is only linked to the lungs. But there can be other causes as well. The first one to think about, really, in your case, is whether there is an element of deconditioning. And this is very, very common, and I'll explain what this means. It's very common in patients who struggle with breathlessness, because what happens is you end up doing less and less of your own activities. You walk less, you move less, and then all of the muscles of your body tend to weaken a little bit. And this starts a bit of a spiral, a bit of a vicious circle in which you really end up doing less and less every day because you're breathless. That causes you to do less. You become then breathless when you try to do it again. So it's one of these situations that can creep up on you, and it leads to this element of deconditioning, which can actually make a lung condition feel much worse than it really is. The other thing is to consider whether heart disease is involved. So especially people who suffer with advanced lung conditions, they tend to be a little bit older. And at that age, you may actually suffer with other health problems as well. And heart disease is one of them. So if you're suffering with heart failure, for example, you would be breathless as well. It's a main cause of breathlessness. The other thing to consider is whether there is a condition called pulmonary hypertension, and that can be brought about by the actual advanced lung disease, but there can be other causes as well. And it just means that the circulation between the heart and the lungs is a little bit impaired, because there is high pressure in that artery, that vessel that connects the heart to the lungs. And I've spoken about this in another video on my channel, so feel free to check that out. The other thing to consider is whether there is anemia. So if you have low iron, if you're having chronic bleeding somewhere, if there's a problem in your digestive tract, for example, and you're chronically anemic, that can also cause you to be tired, fatigued, and it may contribute to the breathlessness as well. And there can be a lot of these overlapping health problems. Sometimes each condition by itself does not mean that the breathlessness will be significant. So it's not enough to cause all your symptoms, but actually, all in all, putting them all together, it can contribute to this sensation that you're feeling unwell. You're really not doing well. Now, what to do? So let's focus on this in the second part of the video. So first of all, I'd like to say this, and it's really hard to communicate this to patients sometimes in clinic when they come to ask for help. It's important to have reasonable expectations of how much you can improve your breathlessness. And I'm not trying to discourage you. I'm just saying that it's not always possible to go back to your baseline from 3, 5, 10 years ago. It may not be possible to get to that stage, especially because some of the advanced lung conditions are not reversible. So we may be able to treat them in a better way, to take the appropriate treatments, for example, to be on the right inhalers, etc., the right medications. But even then, because some of the damage has already been done, we may not be able to recover fully. So this is something that's actually shocking in patients who have had advanced COVID. So quite severe forms of COVID, and then they are really floored by this sudden acute infection. And it can happen for other reasons as well. It can creep up on you slowly with COPD and emphysema, for example, with lung fibrosis, but we must try. So this is my encouragement. We must try to holistically treat many things in our bodies to make sure that the breathlessness is minimized, and we can do the best we can under the circumstances. So this is what I would suggest now. So first of all, we must, like I said before, try to identify the causes for breathlessness in your case, whether it's only the lungs, whether there's something else going on, if there's any discrepancy, for example, between the lung function tests and things like that. So it's really important to do the appropriate tests to try to figure out what exactly is the cause. Like I was mentioning before, whether it's the heart, so you may have an echocardiogram, an ultrasound of your heart, you may have some blood tests, you may have further lung function testing, another scan of your chest. Something called a cardiopulmonary exercise test sometimes can tell us where the breathlessness is coming from. So all these things are important. And then once we find the causes, the illnesses, we do an inventory, we try to treat them individually as best as we can. We may not be able to improve all of them, to reverse all of them, but holistically, if we treat the entire body as a whole, we may be able to reduce the sensation of breathlessness, which you may think is related only to the lung disease. The other thing would be pulmonary rehabilitation. This is hugely important. So pulmonary rehabilitation just means going for a formal exercise program, which is usually led by a physiotherapist. It's usually a group session. These programs are organized in different ways around the world, but ideally you would see a professional who will guide you through exercises that will help you with your breathing. So focusing on the respiratory muscles, focusing on dealing with clearing secretions from your chest, for example, if that's a problem. And then this will really, really help. I think this is really the key to try to get into one of these programs, to talk to a physiotherapist. The other thing you can do by yourself is to keep active, to remember to, even if you're a bit breathless, to try to do something, to go for a walk, to stand up from your sofa, from your chair, to move around the house all the time, to always keep going. I think that's really, really important. If you want to do other forms of exercise like swimming, going to the gym, by all means, try to do that. There are very few instances where people have a contraindication for doing exercise. So talk to your doctor, see if it's safe in your case. But for most people, you can do at least basic things. The other thing would be, if potentially oxygen levels in your blood may be low, it's important to have an oxygen assessment. So an oxygen assessment just means a test in which we check whether your oxygen levels drop when you do some exercise, when you move around. Because if that's the case, you may benefit from extra oxygen. So supplementary oxygen given from a canister for something like that. Some of these things are portable, so you can take them with you if you're going for a walk. It may be psychologically a little bit difficult to accept, but it's important to understand that oxygen, in this case, in advanced lung disease, is a form of treatment. It's not necessarily given only for breathlessness, but also to prevent further worsening of other conditions around the body. So for example, it will keep your heart healthier for longer. So really important. And some people, sometimes when they go on oxygen, especially if the levels go low, they tend to find that they're able to do a little bit more because it helps the heart work under optimum conditions. So in chronic lung disease, this is really important. Another thing to consider, if oxygen is not indicated, because oxygen is not for everyone. Some people do not need extra oxygen because their blood levels are normal. It's important to understand that the flow of air towards your face and airways can actually minimize the sensation of breathlessness. So even if it's not oxygen coming in, because people associate oxygen with air, but it just means that airflow towards your airways can actually help. So there is something called fan therapy. So there are these handheld electric fans, or even like some paper that basically just you blow air towards your face. And if you have an electric handheld fan, it just spins and blows some air towards your face. You just move it in front of you, left, right, up, down, etc. And you try to just feel that airflow and inhale when the air is going towards your airways. And that can actually help a lot sometimes. It may seem simple, it may seem silly, but doing these sort of things can help. And as a doctor in respiratory hospitals, I've often seen patients who prefer to have a fan in the room, or they want to sit in front of an open window. They find that it relieves their breathlessness. So try to see what works for you, but this is one thing you can consider. The other important thing to take into account is whether you have a good coping mechanism for dealing with breathlessness. And I think this is really important because these conditions can creep up on you. You don't know what to do when you are breathless. You've been living a normal life until you've got to this stage with the advanced lung condition. So you must learn how to deal with the anxiety that's brought about by the breathlessness. So do try to consider attending counseling if you're struggling with the breathlessness episode. So sometimes people may become suddenly breathless. They have an episode, they start to pant, they breathe really quickly. That makes them panic and they breathe even faster, and it's just a bad situation. So if that's the case, you can consider going for cognitive behavioral therapy. This is really something that can be done by specialist nurses, certain psychologists who work with patients with respiratory disease, and they teach you how to control your breathing when these episodes come about. And it's really important to know how to do that, because you are able to control your breathing sometimes to consciously calm down and actually breathe normally. And that cuts that anxiety attack, and you end up dealing with these situations much better. Sometimes medication can be prescribed for anxiety. So if that's the case, again, discuss with your doctor to see whether that may help in your case. But it's important to learn how to cope with the breathlessness and to know that it can happen, but that you can get on top of it. The other thing that can be considered at some point, if breathlessness is really, really difficult to deal with, is to be treated with low doses of opioid medication, so such as morphine. So this may seem a little bit difficult to accept for some people, again, because morphine is considered a terminal drug, let's say. For some patients, there are these associations, but actually very low doses that don't even make you feel unwell or feel a little bit fuzzy or sleepy, etc. They can actually help with the breathlessness quite a lot. And it's been shown to be very, very effective. Sometimes you can use sustained release forms of morphine. So this is a very low dose that's sort of given daily, and it just gives you a bit of a baseline. But also there are formulations of quick-acting morphine, usually in the form of a liquid that you just take as needed when you have one of these episodes when you can't control your breathlessness. And it can help in many situations. So it's something that you should potentially discuss with your doctor if it be indicated in your case. But it may not be for everyone, again. The other thing I would say, and this is again moving away from the pharmacological means or medications, to maintain a normal weight. So this is, again, not going too high or too low. So if you carry a lot of extra weight, again, your breathing will be heavier. It will be harder to breathe effectively. So try to reduce your weight. If, however, it's the opposite, you are quite skinny, you've lost a lot of weight, your appetite's not what it used to be, do consider talking to your doctor, to a dietitian, to see whether you can go on some supplements to eat better, to have a little bit of a better appetite, because keeping a normal weight ensures that all your muscles are operating at top efficiency. The final thing I would say is that it's really important with advanced lung disease to prevent further worsening. So if you already suffer with emphysema, for example, and it's really advanced, you don't want it to get worse. So try to take your treatments as indicated. So if your doctor prescribed certain inhalers, try to take them regularly. Try to always connect to your doctor, link up with them and go for follow-ups, see if there's anything you can do, see if there's anything that can be added. Has there been a new treatment approved on the market that could be used? So all these things, try to take your treatments as indicated and to adhere to the therapy. And if you have any problems, go back to your doctor, see if any changes need to be made. And the other thing would be to stop smoking. So if you are smoking still and you have advanced lung disease, it's really important to consider stopping. Now, there may be a lot of difficulties to doing this. It's really hard. It's one of the hardest things that people do. But stopping smoking can actually stop the progression of advanced lung disease. So you don't want to get worse in 3 years from now. Think long term. If you are breathless now, how will you be in a few years? And try to maintain the level. Try to achieve stability. Be out in fresh air. Don't just sit inside the house. That's just going to help you cope better, to move around, to be exposed to fresh air. You'll maybe avoid certain exposures in the professional setting at home. Try to avoid all these things and try to keep a healthy diet. Like I said before, keeping a healthy weight, keeping all these things going, a good health will help prevent further worsening, not only in the lungs, but in the rest of the body as well. So to conclude, it's not easy. It's not easy to deal with breathlessness in advanced lung disease. And unfortunately, some of these conditions do not get better, but it's important to keep going, to not give up, to keep trying. Try to get a good support network, to have friends, family members who support you to get better, to feel better. And attend counseling sessions, group sessions. Sometimes there are patients associations in your area which may help you cope better with your situation. Sometimes it helps to just talk about your problems with your breathing with other people who have the same issues. And sharing ideas is really important in a professional format, in a professional forum. So don't give up if you're struggling with breathlessness. Come back to this video, have another look at it, see if any of these ideas that I've spoken about would be helpful in your case, and talk to your doctor, see what can be done, and don't give up. Don't give up. All the best and good health.